Hello, everyone. Welcome to the Dr. Sophia ObGyn podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia ObGyn podcast. All right, so we're going to just dive right in. I am so excited, as always, to be here with you, and especially to discuss a topic that I basically feel is bread and butter ObGyn. Definitely a part of my everyday life is going through the confusion of whether or not things like BV are an STI, meaning is it sexually transmitted, or how can I avoid it, or how do I treat it? And actually two other bacteria that are less talked about, but also can cause BV-like symptoms.
BV being?
Bacterial vaginitis. And the last one on the topic that I'd like to cover today is HPV. And so without further ado, I am joined by my good friend and co-host, Touseef Mirza.
So this conversation around STIs, which is sexually transmittable diseases.
Or sexually transmitted infections, yes.
Or STIs, or D for the disease part, STDs. And when we started to talk about it, Sophia was telling me about a couple of issues that seems like STIs or not STIs, but because when we think about STIs, a lot of us think about maybe chlamydia, gonorrhea, herpes, like those are the typical bag. But she talked about, for example, BV, HPV, and I was like, well, usually we don't consider that as STIs. And you're like, well, this is where it's interesting how you start to look at what are they actually and how they actually come up. So it's going to be a little bit of a exploration on how to talk about this, because as she said, every single time she needs to explain it to other patients. But I think it's important for all of us, including myself, to understand like what are these nuances that we want to talk about. So we're going to go over three main ones, right?
So part of the reason why I really wanted to do this episode is because every single day I treat someone in the office for something like BV. And BV being bacterial vaginitis, a woman comes in, she's complaining of vaginal discomfort, maybe a little bit of discharge, and usually some form of vaginal odor.
And vaginal discharge, so meaning certain...
Like a little bit of discharge. It doesn't necessarily mean that it has a different color. It could just be a little bit white. It just may be a little bit more of it. But nonetheless, she notices some type of a change in what her vagina is normally like. And so the first thing I usually go to is, well, have you changed anything about your normal routine? Have you used a brand new soap? Did you go on vacation? Have you been to a pool? Only because anything that changes the vaginal flora or the fauna, meaning the normal bacteria that we expect to be there, can cause an infection like BV.
So this could be, for example, you're changing laundry detergent.
Even as simple as changing laundry detergent. Yes. Mm-hmm. Yes. And it's hard to it's almost sometimes like it's like mind blown. Why? You know, but our bodies are really that sensitive, and especially our vaginal area. So when we do have these little changes, the bacteria that causes BV is actually a bacteria that is always in the vagina.
So it means that just because you have the BV bacteria doesn't mean that there's necessarily a problem.
Right. In the sense that BV, when we think of it as bacterial vaginitis, is when we think about an overgrowth of a particular bacteria that's in the vagina.
So it means if that, I guess, concentration of that bacteria is in check, then there's no problem.
That is correct. That's a great way to put it.
Okay.
Yeah, keeps it in check. We have other bacteria. It's like these little armies that are constantly fighting each other in the vagina. And that's how they kind of keep each other in check. And by keeping each other in check is what we call balance. And in that balance, there's the pH balance, or the pH level in which the vagina likes to have everybody be in check and stay happy. And when the pH level of the vagina is increased, this is when you have a susceptibility for certain bacteria to overgrow.
So is it similar to yeast?
Yeast is different. Yeast is a fungus. And again, also lives in the vagina. However, again, it's also about how much.
So, but the yeast, again, it can stay in our bodies without being a problem. Like
That's
we do
correct.
have
Yeah,
yeast.
all the time. We have yeast. We have it on
Right.
our skin. We have it in the vagina. However, when yeast gets to a critical point in terms of growth is when we have a yeast infection.
Okay. All right. When it's kind of like overgrown or out of control,
Yes.
then it has all these different symptoms.
That is correct.
So what are typically, if somebody has now an excess of the bacteria of bacterial vaginitis, do we know the name of the bacteria?
It's usually Gardnerella.
Okay.
That usually is one of the ones that we think about when we're thinking about BV. But the whole reason of bringing this point up is because women often get tested for BV, but there are two other bacteria that come to mind that women probably don't even know about and are less frequently tested for. One of them is called ureaplasma, and the other one is called mycoplasma.
See, I have never heard of either of these words before we started to talk about this together today. So, like, I've never heard of those.
Right. And so these are bacteria that also can be in the vagina and also can kind of cause a BV-like syndrome or symptoms, or they are what we consider as can be part of the flora, so to speak. But either in certain quantities, or what happens is we don't really test for them. And so a woman comes in, we test for BV, we treat her for BV, but we don't test for mycoplasma or ureaplasma. And so a few weeks or a few months later, she comes back and she has another BV infection. And the reason why I'm even bringing it up is because these other bacteria can sometimes kind of live synergistically with BV.
So, BV, what are the typical symptoms that a woman can feel with BV?
Again, she's going to have like discharge. She's going to have perhaps a smell.
But is there itchiness? Is there burning during urination?
Maybe not. They can have burning during urination. They can have itchiness, but it's not like itchiness in the same sense of ways that we often think about, like as a yeast infection that is like pretty much hallmarked by this vaginal itching associated with discharge. I think the one with BV is a little bit more subtle, and it can, most of the time they just say that they just have a sense of discomfort. Granted, they can definitely have itchiness, but I wouldn't necessarily say that itchiness is like hallmark.
Okay. So it's more the smell and the
Usually
discharge.
it's the discharge, discomfort.
Okay.
So they know something's off. They don't always know what is off.
You just feel it.
You just feel it. Yeah, exactly. And smell, no smell, something, it could be a smell that they are used to. It could be a smell that they're really not used to. But I would say those are the things that they would probably more so complain of.
Like as you're talking about this, especially if there's no itchiness, like I'm wondering even if women who probably have BV, like don't even come and see you because they just think, oh, it's just a little discharge here and a little different here, but it's not something necessarily that is a physiological ailment per se. So do you find that it can go even under the radar a lot of times?
I definitely think it can go under the radar. Like I said, because it's almost like it has to get to this like critical point where they may feel a certain level of discomfort or a certain amount of discharge that then becomes bothersome, so to speak. Many times I will have a woman come in for her routine exam. So she's coming in for what we call an annual. She's maybe having a pap smear done. And in the middle of that exam, I'm like, okay, your discharge looks a little bit weird or different. And I ask, before I say that what I'm thinking, I'll ask, were you feeling a little different? Did you feel like you had a little bit of more discharge this week? Do you feel like you may have a little bit of a different smell? Are you having any smell after sex, for example? Are you just noticing any changes? And I would say maybe 75% of the time, they'll be like, oh yeah, I kind of felt a little off, but it's not necessarily what brought them in. And so I'll test them, and then the swab will come back positive for, BV.
And that's usually an antibacterial treatment?
And so for BV, yes, the treatment for BV is typically giving some form of an antibiotic, whether that's a vaginal antibiotic or an antibiotic that they have to take by mouth. But it usually is the treatment is an antibiotic. The thing, though, to note is that when we diagnose somebody with BV, they can, in fact, have these other bugs present as well.
Bugs meaning bacteria.
Meaning bacteria. Yeah, the ureaplasma and the mycoplasma.
Okay.
And so that is what makes it so critical that we actually test for it, because when a woman is experiencing symptoms of BV, it's quite possible that she's also then have a critical amount of ureaplasma or mycoplasma that could also be causing symptoms. And the interesting thing is that, like you asked, does it cause burning when they urinate? Does it cause a different kind of system or symptom? And in fact, it may tend to have a little bit more like of the itchiness associated with it, or a burning sensation.
For the uroplasma.
For like the uroplasma or the mycoplasma, it may have a sensation of dryness more. It may have a sensation of burning, with urination, despite not having an actual like urinary tract infection. And I think the thing that really sets them apart, or why it's so important to understand, is because of the fact that in the case of ureaplasma and mycoplasma, there's a couple of other things that they are associated with. So things like preterm labor, preterm birth. These are bacteria that are often found after culturing, let's say, the placenta or the amniotic fluid of women who have had preterm labor or preterm birth.
If I understand correctly, you're saying that the mycoplasma and the ureaplasma, I'm just learning how to say these words, so I'm pronouncing it
Good
very
job.
well. Thank you. For these two bacteria, if they are left undetected and that they are at a high sort of concentration and a woman is pregnant, then it can actually cause the delivery of a premature child.
Yeah, it has an increase. It carries the increased risk of preterm labor and preterm birth. So it significantly, actually, I would consider it significant, because it can significantly increase, and that's BV as well. Let me just be clear. We're talking really bacterial vaginitis and then the concomitant bacterial infection with ureaplasma or mycoplasma, and that increases your risk of a preterm birth. And that's one aspect. But the other aspect, and the real reason why we're having this conversation, is because I've already said that, okay, well, these are bacteria that can be normally found in the vagina. But there is an aspect of it that can be considered sexually transmitted. Now, we don't really think about it as being an STD or an STI. However, we know that, for example, women who get these infections constantly, that it may be because their partners are actually carriers. Oh, I know. I see your face. I saw the light going ding, 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 ding.
Because the thing is, it's called bacterial vaginitis. Hence, the bacteria lives in the vagina, and men don't have vaginas. So where is the bacteria on the man?
I mean, on his penis? Like, girl, I am not a man doctor.
Yeah.
But what I will say is what happens is that, I mean, this is what makes this so confusing and so hard to even have the conversation when I'm talking about it with my patients. And part of the reason why, as always, there was a patient story associated with this, right? I had a woman who came to see me, and she's happily married, and she's coming to me, and it's like month after month after month, I'm treating her for BV. And
Meaning she's coming, you're giving her the medication, she takes the medication, she comes back,
she feels
still has
better.
this-
Well, what happens is that she feels better for a couple of weeks, and then she comes back with it again. And then she feels better, and then she comes back with it again. And so we were both kind of like, what is it? What haven't we checked? Because we've checked everything. You don't have a quote unquote STD. This is not chlamydia. This is not gonorrhea. This is
Not a yeast infection.
Not a yeast infection. This is not what we would typically check. And the light bulb went off like, hey, did you do a comprehensive swab? Does it also have mycoplasma and ureaplasma? And I was like, you know what? It doesn't have that. Let's check. And sure enough, she had mycoplasma.
So even if you were treating her for BV, since you weren't treating, I mean, we don't know if did she have BV also?
She had BV.
And she also had mycoplasma.
And she had mycoplasma.
Okay. And since you were only treating the BV, the mycoplasma just wasn't resolved.
The mycoplasma wasn't resolved. And I don't know, I'm not going to, act like I'm an infectious disease doctor. I'm not. But I will say that what it seems is that there's something about mycoplasma and BV that kind of works synergistically. And so it's like by the presence of mycoplasma made it easier or more susceptible for her to continue to keep getting BV. And the real thing here was the fact that she actually did not get better, A, until I treated her for the mycoplasma, and B, that I not only treated her, but treated her husband.
For mycoplasma?
Yes.
Not BV.
Right.
Okay.
And so the thing is that the antibiotic that we use to treat BV is different than the one we use to treat mycoplasma. And so until we treated both things, and until we treated her husband, she did not feel better. And the thing is that her husband was not having any kind of symptoms at all.
And did you test the husband?
No.
Okay.
No, we did not test her husband.
Okay.
Honestly, I don't even know how one tests men for these things. I guess it's like a Q-tip, this similarly to what we do for women, but I'm sure that men are not being tested for this. This is not, again, because it's not your typical like STI. It's not your typical, and in all honesty, this is not like it's unlike chlamydia, right? Which is completely foreign. Chlamydia does not live in the vagina. It's not gonorrhea. Gonorrhea doesn't live in the vagina. These are foreign. So when we think about a sexually transmitted, it's easier to understand the concept of, okay, I had sex with someone who had this thing and therefore gave it to me.
So I think this is a very important distinction that when we talk about STIs in terms of like chlamydia, herpes, gonorrhea, is that it is an external organism that was not in your body that has now entered your body and is causing all this havoc.
That's correct.
Versus what we're talking about in terms of BV, mycoplasma, ureaplasma, these organisms already live in us, but in a controlled fashion. And if they're uncontrolled, then they can cause problems.
Yes. And the other thing is that not everybody has it.
Not everybody has what?
So not everybody has ureaplasma. Not everybody has mycoplasma. You don't always have it. You don't always express it. You know what I mean? It's not like, so again, this is why it gets
the nuance.
The nuance.
Yes.
And the real reason that I even really wanted to talk about this is because of their relational or relationship with BV, which is a very common infection in women. I mean, up to 30% of women around the world experience BV at some point. That's a lot. And if you have BV, you can have a recurrence of BV after being treated for BV in like up to 50% of the time in the next 6 months. So given that fact, knowing that you have a 50% recurrence rate of BV, knowing that 30% of women experience BV at some point, it makes you want to understand, well, what else could be involved or around why this is so common. Now, like I said in the very beginning, the real reason is because we've done something. We have changed something purposefully, not purposefully. Women are like honed into our vagina many times. So we want to make sure it's always fresh, make sure it's always this and always that. And we sometimes, in changing our normal routines in order to make it smell more like flowers,
Which I don't understand, but okay.
you know, we always want to like get the latest and greatest from Bath and Body Works or whatever. And so we inadvertently will have a change in our pH balance.
It could also be the diet.
It's so many things. Your diet is definitely involved in our vaginal flora because your diet is involved in your gut bacteria, and that gut bacteria then influences your vaginal bacteria. And so for sure, your diet influences it. Like I said, your normal like personal hygiene regimens influence it. If you travel, influences it. Like you're going latitudes, going into different waters, not because there's something wrong with the water, but the way your body responds to it. Stress. Stress has an impact on what's going on with your vagina. And so many things have effects on our normal vaginal flora.
So just so I'm clear, when it comes to ureaplasma, mycoplasma, and what's the bacteria associated with BV?
Gardnerella.
Gardnerella. So those three, all women have it. Not the bacteria.
We have the potential to have it. It might be a part of my normal flora. Okay. But maybe it's not in yours.
Oh, okay. So not everybody necessarily even has it.
Right.
Okay.
But just because you have it doesn't make it an infection.
Okay, so there's 3 levels. This is what I'm understanding. Some of us have this bacteria, some of them us don't. And then some of us who do have it, sometimes we stay always within balance, so everything's fine. And the third one is the women who have it, sometimes it is in imbalance and they have too much of it, and then that causes problems.
That's it. Now you got it.
Now I got it. Learned so much today.
But the thing is, mycoplasma, ureaplasma, I would say is not the most common of the bugs. Okay. And so it is one of those that when I do see it, especially in association with a woman who's having BV and is having recurrent BV, it does lead me to think if they have a partner who is a regular partner for them, that partner may be a carrier. And when I say a carrier, it's that sometimes it benefits them for themselves, the woman to be treated, as well as their partners to be treated in order to completely eliminate the bug.
So do many doctors actually, or OBGYNs, treat women for ureaplasma and mycoplasma, since we don't really, I've never heard of that before. I've heard of VV, but not the 2 other ones.
Right. Okay. So here's the thing. I would say that it's not a part of our normal panels. It's not a part of, like, if you go to your doctor and you're like, oh, I think I have BV, and then they're going to check for all of these things, especially if it's like the first time you've ever had BV.
But if you go, for example, if you go to your doctor on the yearly checkup and they said, do you want to be tested for STDs? And they say, okay, do you want to test for everything? And you test for everything. They're not going to test for BV usually, or mycoplasma, ureaplasma.
No.
Okay.
No, because we don't think of BV as an STI.
Right.
Right. It's just a change usually in your pH balance that causes BV. And then ureaplasma, mycoplasma, like I said, we think of that more when we're considering like recurrence. Like, could this be at play in terms of what's causing the recurrent BV?
So when you are able to treat BV and or mycoplasma, ureaplasma, is it usually a successful treatment?
I would say yes, it is usually a successful treatment. Once we know what we're treating, the treatment course usually is successful, and especially when we do treat the partners. When we treat the partners, we treat the patient, we treat the partners, we have them abstain during the time of treatment in order to completely eradicate the bacteria. We find that they don't come back with recurrent symptoms, and their cultures are usually negative.
All right, well, that's good news.
That is good news.
So when you finally actually do the right test and get the right treatment, it works.
It works.
Okay.
It works. But here's the caveat to all of this, is trying to explain to women that you have a bacteria. I actually want not only you to be treated, but I also want your partner to be treated. They're like, well, what do you mean? My boyfriend gave me something. My husband gave me something. And then I have to be like, well, no, not exactly. I just think that maybe they are, again, the best word that I can use is something called a carrier, meaning that they have something that doesn't affect them, but they have the potential to keep reintroducing it to you. And so that's why treat both people. And the explanation then is, well, we are in close contact. You are my partner. We are in close contact. And so in order for me to feel better, I have to treat both of us so that I can always feel better.
And usually the issue of mycoplasma, ureaplasma, or BV, usually it does, I guess, start from a woman's side, but then a man could be a carrier of it.
Yeah, the thing is that when we're thinking about mycoplasma, ureaplasma, a man could be a carrier for this. You know, a woman, like I said, not all women have it.
Like, let's say a man has never had sex before. They're not going to have that in their bodies.
It's unlikely.
Okay. So usually, how do the men react to that? Are they pretty positive about it?
This is where it can get a little hairy, because when you're trying to explain something that you're like, well, this is not really an STI, but it is, because it can be sexually transmitted, meaning that it's because your partner is carrying it, therefore reintroducing it to you sexually. That's why you keep having it. Like, okay, so is it an STD or isn't it an STD?
We almost need like a new categorization for it almost.
And the reality is that it kind of is.
Yeah.
Because it can be sexually transmitted, but it kind of isn't, in the sense that it's not a foreign bug. It could literally be part of the normal flora. It's a gray zone.
So that keeps you on your toes as an OBGYN.
Always keeps me on my toes. Always keeps me on my toes. And the other thing that kind of resembles that in my daily practice, like part of my bread and butter, is probably HPV, or the human papillomavirus.
Please say that a little slowly.
Oh, right. You know the New Yorker in me. It's not my fault.
I know. You're like boom, boom, boom.
HPV, human papilloma virus. Now, the reason why I bring it up is because it's similar in the sense that it's a hard conversation to have with a woman, to explain to her, okay, you have HPV. HPV is, in fact, sexually transmitted and is a sexually transmitted infection. And why it's a sexually transmitted infection? Because it is something that is foreign. We are not born with it. It's not going to be something that we're just living with, and that, no.
So it's like in the category of chlamydia, gonorrhea.
Yes, it is in the same category as chlamydia and gonorrhea. However, unlike chlamydia and gonorrhea, where it can also cause symptoms in men, like acute symptoms in men, the same way it causes acute symptoms in women. So in women, those bacteria, chlamydia, gonorrhea, they'll cause a cervicitis. They'll cause, meaning an inflammation of the cervix. They cause significant discharge. They cause discomfort. They cause pain with sex. They cause vaginal odor. there is something happening with a woman when she has chlamydia or gonorrhea. Although chlamydia is also a little bit more tricky. However, still relatively, I would say, acute.
Meaning that it is happening all of a sudden.
Yeah.
Okay.
Meaning there is some type of a change that's happening, and it usually is all of a sudden.
So if you're with a new partner a week ago and then all of a sudden this is happening, you can associate it with that most likely.
Yeah.
Okay.
Yeah. There's going to be a strong correlation that that's the person who gave you, right? Like the concept is that somebody gave you this.
Transmitted
The
virus to you.
Exactly, the bacteria. But in this case, chlamydia or what have you. And for what our purposes of this conversation, we're talking about HPV, which is a virus. Now, the funny thing about HPV is that, first of all, there are 150 different types of HPV.
What?
Yes, girl.
What do you mean 150?
What I just said. There's over 150 different types of HPV, and not all of it causes symptoms. Not all of it, like HPV or human papillomavirus, also causes warts. Like, who knew? You know what I mean? Like, well, I knew. Yes, of course. Yes, but like, you know, when you went to college, they're like, make sure you wear your flip-flops if you're using the communal bathroom, for example, because of communal showers, because you don't want to get something called plantar warts. Plantar warts are caused by one of the 150 different types of HPV.
Okay, so it's not just associated sexually or around the vulva area. It's just a guy that's all over the place.
HPV, there are 150 different types that affect different parts of the body. When we talk about it as far as sexually transmitted, we're talking about what it can cause in the genital area, and oftentimes it causes zero symptoms. People don't know that they have HPV. But women, 80% of women will be exposed to some type of HPV at what we call sexual debut, meaning the first time they even have sex.
Sexual debut.
Sexual debut.
In the spotlight.
Yeah. Yeah, it's not such a great spotlight if you have an 80% chance of getting something. But
so you're saying that women have a tendency to get HPV the first time that they have sex?
Yes.
Like 80% of them?
You have an 80% of women who are exposed to HPV are exposed to it the first time that they even have sex.
Got it. So if you have it, most likely it started with the first time.
Most likely, but you can get it at any point.
Okay.
So the problem with HPV, it has no symptoms really, unless you get one of the types that causes something like genital warts. But the reason why HPV is so important to know is because there are certain high risk HPV types that can lead to something very dangerous called cervical cancer. So you can go on for years, no symptoms, but HPV is working on the background at the level of your cervix, causing changes to the cells of your cervix.
So are you saying when I go and get a pap smear and you're getting a swab to check if I have any issues on my cervix from a cancer perspective, it could be caused from HPV?
Yeah, I'm checking. When I do a pap smear, I'm looking at both the cells and if you have it and if you have HPV.
Are there many causes for cervical cancer aside from HPV, or it's mostly caused by HPV?
So the thing is that cervical cancer is caused almost 90% of the time by HPV.
Oh, wow. Well, now the plot thickens. Like now it's like, now we're talking about sexual debut, and then we have the HPV, and now we're talking about pap smears, and now we're talking about cervical cancer. I mean,
I know.
There's so much stuff here.
It's confusing. That's why I felt the need to have this conversation, because I have to have it all the time with my patients. And it's hard to explain it when you say, oh, well, it is an STD. So it is an STD, but I can't go back and test my partner And it makes it so like illogical.
And why can't they go test a partner?
We don't have a test for men for HPV. We're not
There's
checking.
no test.
There is no marketable exam or anything that's testing men for HPV. No. And I mean, yes, for certain penile cancers can be related to HPV and HPV exposure. But again, there is no widespread screening that's happening for men checking to see who has HPV and who doesn't. And I get it. One of the reasons why is even for women who have HPV, our bodies are so smart that our bodies fight HPV. Our bodies fight HPV. And if we give our body good nutrients and have a good immune system, then the likelihood is that our body is going to fight HPV, and HPV is not going to be able to wreak the kind of havoc that it wants to. And so we clear it naturally if we give our bodies enough time and all the good things that it needs in order to be able to do that. So it's like, yes, it's a sexually transmitted infection, but even without any treatment at all, our bodies are going to take care of it. And so if our bodies are going to take care of it, then what's the big deal?
Right.
But the big deal is that for women, it has the potential to cause cervical cancer. And so thank God we have a screening test called the Pap smear that allows us to look to see if we're having changes on our cervix, changes that can eventually lead to cervical cancer. So that way we have an opportunity to intervene.
So is there another way to test the HPV virus levels aside from a swab from a Pap smear?
It doesn't necessarily need to be exactly a Pap smear.
Okay.
It can be just a Q-tip or a swab in order to test for HPV.
Because are you having symptoms if you just have HPV without necessarily the long-term sort of effects of potential cervical cancer? Like, does a woman feel uncomfortable in the vaginal area or something like that if she has HPV?
So this is where it makes HPV one of those outliers, right? Because the thing with HPV is that there are zero symptoms for the woman. A woman can have HPV and never know she has HPV. The only reason why a woman will know that she has HPV is because it came back positive on her Pap smear. It's not because she's having symptoms of HPV unless she has one of the strains that causes genital warts and now has a genital wart. And I will say that that is a reason why a woman would probably come in and say, hey, I feel like I have like a little growth, or I see something on my vulva area. Can you tell me what that is? And then you either test it, biopsy it, remove it, and then get it tested in the pathology, and you recognize and you see that it's a genital wart and it's related to HPV. Otherwise, no, a woman would not have symptoms of HPV.
Okay.
She's not having, it's not like even the other ones that we talked about, like those that can cause bacteria, like a BV, that actually can cause symptoms, discharge, smell, etc.
I can see now the importance even more of Pap smears because,
Yes.
right? Because there is no symptom of HPV aside from the genital warts. Therefore, how will you know if you have the progression or the start of cervical cancer if you don't show any symptoms? There's
correct.
No test.
That's correct.
So you have to go do the Pap smear.
Yes. Because of the fact that we actually do Pap smears is the reason why the incidence of cervical cancer is so low. Before the start of routine screening with Pap smears, women were dying all the time of cervical cancer, a disease that is actually quite curable, preventable, etc. The fact that we screen women for HPV, and by screening women, by doing Pap smears, that we're able to pick up whether or not they have an HPV exposure, has dramatically affected the concept of cervical cancer. especially here in this country. I will say that in developing countries where they don't have wide screening programs, unfortunately, women are still dying of cervical cancer. It's still one of the leading causes of female cancer deaths in the developing world.
And do men have any type of cancers associated with HPV?
There are some penile cancers that are associated with HPV. I guess because of the fact that HPV, like I said, is a virus, and it's a virus that mostly our bodies clear. Therefore, it's probably why there's no big screening for men, even for HPV. But it's an STD. How do you really prevent it? Like, yes, of course, prevention is key. Wearing condoms is extremely helpful in preventing the transmission of HPV. But take, for example, a woman, she's getting married, she's, been with her husband for the last 5 years and has HPV. Does that mean that her husband was stepping out on her? Does that mean that she was stepping out on him? No, not necessarily. HPV also has that little caveat also. Forgot this part. HPV has the capability of laying what we call dormant in the body. What does that really mean? It means that, yes, there's a point in your life where you may express it, or you may never express it, or it can show up, then goes away, and then shows up again. And so that's something that also makes HPV so confusing. I can't say if you're a woman and you've had, let's say, 4 lifetime partners, which one of your partners actually gave you HPV. I have no way of telling that. So it's like, oh, okay, I maybe had it before, then it completely went away, like you did my pap smear and you don't see that I have HPV, but here I am 10 years later and I have HPV again. So yeah, this is the part that makes HPV frustrating. And very frustrating, both as an STD, from an STD standpoint, as well as from a standpoint of, wow, this is a virus that can potentially live in my body and could always cause me to have an increased risk for, let's say, cervical cancer.
So what is the age that women need to start having pap smears to check on?
So women typically start getting pap smears. The age now is 21. And one of the things that we do know about HPV is that your body will clear it, or again, the confusingness. Yes, it clears it, but yes, it can stay dormant. But yes, the reality is that for the majority of women, they will clear HPV and they will never express HPV again. And so from the ages of 21 to 24, we check to see if you have any changes on your cervix in terms of the cells. And not everyone is checking to see if you also have HPV. Reason why? Because we know you will likely clear it. And so it takes anywhere from 18 to 24 months to clear it. And if we just give your body time, then you won't be susceptible to having to get like invasive testing that you really don't need. And so when we think about it in terms of younger women, we know that like 90% of younger women are going to clear the HPV because they're young, they're healthy, their bodies are going to do what they're supposed to, and it's not going to be a problem for them.
It's almost like the immune system.
It's totally like it is your immune system.
It's your immune system, okay. So there was a treatment for BV because it's a bacteria. There's a treatment for mycoplasma and ureaplasma because it's a bacteria. But when it comes to HPV, there's no treatment. You can only be treated if you have been found to have those cervical cancer cells.
There's really only treatment of the abnormal cells, yes.
Okay.
Right? So what we'll do is we'll do some kind of, if it's at a point where those abnormal cells are dramatically abnormal, then yes, there's an excisional procedure that can happen in order to try to clear away or cut away those abnormal cells.
Like you literally remove them.
We literally remove them. Your cervix gets it's like having a fresh start.
Well, at least there's a solution. I'm happy to hear that.
Yes, there is a solution. I think the most important thing to know when it comes to HPV is very immune sensitive. The healthier you are, the less likely HPV is going to be a problem for you. Your body is going to keep fighting it and take care of it and do what it's supposed to do. And then I would say primary prevention is always key. Be picky with your partners. Getting something called the HPV vaccine. It does have right now on the market, there's the one that has 9 of the potentially most high risk types.
Including the one for cervical?
Yes, including the ones that can lead to cervical cancer in order to help your body to either fight it or prevent you from even getting it.
So then being healthy, getting pap smears on a regular basis.
Yep. Vaccination,
and wearing
condoms,
having protection.
So
by having all of these, like we're in a good place.
Yes.
Where we're trying to figure out the deal with HPV. Well, I think you did it, Dr. Sophia. You were able to go through this nuanced road of all these different aspects.
I hope I didn't make people more confused, honestly, but I just get these questions or have to talk to women so often about these particular things. So BV, yes, requires an antibiotic. Ureaplasma, mycoplasma, yes, requires an antibiotic and maybe an antibiotic for your partner. HPV, pap smears, healthy. And healthy is for everybody. This is not even just only for HPV. This is for your BV people, your everybody, right? Your better food choices, exercise, etc. All of that leads to just better immune system, which is going to help you to not have these fluctuations or changes in your body that lead to changes with your microbiome. But when we talk specifically about HPV, it's really like being healthy, staying away from things, smoking. A total modifiable risk factor for HPV. Like if you smoke, really don't smoke. These are ways in which we can just continue to hone in on how to keep ourselves healthy, safe, feeling good, living a sexual life where you feel armed with information and can protect yourself and still have fun.
The last thing I just wanted to mention is, so we know that, for example, the HPV, it's sort of like more standard with the pap smear. But when it comes to mycoplasma and ureaplasma, since you say that not all providers will test for it, can a patient actually ask for that if the healthcare provider has said, okay, maybe it's BV, and since they don't necessarily associate right away with mycoplasma or ureaplasma, that the patient could bring that up?
Yes. Absolutely.
Okay.
Absolutely. You can certainly ask, hey, is it okay? Do you think you can test me also for something called ureaplasma and mycoplasma? And that's absolutely fair game.
Okay.
Absolutely. At the end of the day, I'm just glad we were able to have this conversation. So that way we can provide some clarity in an area that can seem like a gray zone. And just by giving a little bit more information and education will continue to allow women to really do exactly what we want them to do here on Dr. Sophia, which is always embrace your body and embrace yourself. Bye for now.
Bye.
Bye. This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.